Poto Williams.
Thank you, Mr. Chairman. There's nothing that kind of gets the public emotion and the public stirred up quite like issues around health, because in this country we have an expectation of a level of health care, and there's no doubt that over the last few years there has been some systemic failures within the Southern District Health Board, but it hasn't necessarily been the fault of the board necessarily. The board has had to deal with some pretty big, gnarly issues. The amalgamation of a couple of boards is certainly not going to be an easy task to manage, to cope with, considering we've already heard tonight there are issues around differences in funding bases for one area as opposed to another area. But health is at the heart of what we see as a good democracy, good access, easy access to decent health care. And it's no wonder that there are a range of views across the House about how that should be achieved. When I sat on some of the submissions, there was half a dozen, a few more. There were a couple of submissions that talked about our absolute commitment to ensure that there are good outcomes for Māori. And one of the submissions was made by Te Runanga or Ngāi Tahu. And their concern was that they did not believe that under the provisions of the Treaty of Waitangi that their ability to have full access to good health care and well-being was fully acknowledged under the role of the imposed commissioner. And they were seeking some redress around this. And we talked about it throughout the Select Committee, and even in the report that came back to the House about it, talked about the discussion that we had. It was fairly clear that that is not within the scope of the bill, but it was an important aspect that we felt needed to have some acknowledgement, which is why I raise it today. Because one of the suggestions that came up in the Select Committee was with regards to the ability to appoint deputy commissioners, and would it be an opportunity to consider appointing a deputy commissioner to cover off the concerns of Ngāi Tahu around significant involvement for the Runanga in the work of the Commissioner as they were working through these particular issues. Now, I know that we have, in our report back to the House, said that that is not within the scope, but it is certainly something that I think we should consider, given there were significant concerns by Ngāi Tahu about our obligations under the Treaty of Waitangi. The other concern that came through loud and clear from the submitters was about transparency. And in most of the submissions, what people were concerned about was their ability to not only participate and contribute to the discussion, but actually to hear about the decisions and the decision-making process that was happening with the Commission and the Deputy Commissioners. It's very clear that the people of the region are wanting a say in how the review and how the work of the Commissioners occurs, because they are in such a serious state, because we are in the position of having to disband the board and appoint commissioners. It has raised the level of concern within the community, and obviously it's raised the expectation of the community that they will be able to participate fully within that environment. So rather than being dismissive of that, it would be a useful thing if the Minister could talk about opportunities to ensure that those voices are heard, that there is a significant opportunity for the people of the Southland catchment area for the District Health Board to feel that they are able to feel some comfort in the process. The last point I want to make is something that my colleague Dr. David Clark touched on, and that was about the ability to ensure that the considerable capital works program that needs to go on, there's no doubt that the hospital at Dunedin is seriously overdue, Mr Chairman. It's seriously overdue in its rebuild, and there has been a long period of time where maintenance hasn't been undertaken to the standard where the building is actually fit for purpose any longer. And I'm hopeful, and perhaps the Minister can answer this question, that may become part of the work that the Commission does to ensure that work is scoped properly, that the considerable works program that needs to occur is fully considered. Just on a final note, I agree the SOP that has been put up by Honourable Annette King actually makes a lot of sense. It does make a lot of sense to ensure that we give the appointed commissioners time to do their work. However, when the work is done, we should not be beholden by the fact that the elections have been cancelled as opposed to postponed, to ensure that we get back to a full democracy as quickly as possible. So it would be an important point to consider changing the word from cancellation to postponement. It is a simple amendment, but it actually makes a lot of sense in the ability to ensure that timeliness in terms of democracy is returned to the people of Southland.
Chair. I call Reno